Okay, so we talked about the origin of diaphragm. So this was the right crest and this was the left crest of diaphragm. The right crest was originating from L1, L2 and L3 from the intervening disc 2. So few facts about the right crest is that it's longer and stronger than the left crest because the right crest pull down liver during each inspiration. Also, the right crest acts as a sphincter at the gastroesophageal junction. Now we talk about the insertion of diaphragm. So the insertion of diaphragm is at the central tendon. When we talk about central tendon, I told you here that in the peripheral part we have the muscular fibers, whereas in the center of diaphragm all these muscular fibers converge and form the central tendon, and central tendon is the insertion of the diaphragm. So the central tendon is trefoil shape. It has two lateral and one in the middle, a foil, making a trefoil shape. So its shape is trefoil shape. Okay, at which level central tendon is present in our body? It's present at the level of xiphi-sternal joint. It's present at the level of xiphi-sternal joint. One important point to remember about the central tendon is that it's inseparable. We cannot separate central tendon from the fibrous pericardium because central tendon and fibrous pericardium has the same embryological origin. That's why they are inseparable even in adults. Okay, so now that's all about the central tendon and the insertion of diaphragm. Now we talk about the openings in diaphragm. So we have 3 large openings in diaphragm and few smaller openings. So first we talk about the 3 large openings. These large openings are also called apertures and also called hiatus. These are present at the level of T8, T10 and T12. Okay, at the level of T8 we have the vena cava. At the level of T8, T10 we have the esophageal opening or esophageal hiatus, and at the level of T12 we have the abdominal aorta. Okay, how to remember this? Okay, so in vena cava we have 8 letters: 1, 2, 3, 4, 5, 6, 7, 8. So these 8 letters are present at the level of T8. The esophageal opening, having 10 letters, are present at T10. This large spelling is present at the level of T12. Okay, so when we talk about this vena caval hiatus is present in the central tendon. The esophageal hiatus is present in the left crest, and the aortic hiatus is present in between the right and left fibers. Okay, so in the vena caval hiatus we have few more things. In the vena caval hiatus we have the inferior vena cava passing through it, and the right phrenic nerve and lymphatics. Okay, in the esophageal hiatus we have, of course, the esophagus and the esophageal vessels and the gastric nerve plus the gastric nerve. What is the gastric nerve? Yes, it's the vagus nerve. In the abdominal aorta we have the thing passing called the, learn the mnemonic, ATA. We have, of course, first the aorta, then we have from T we have the thoracic duct, and from the A, the last A, we have the azygous vein passing from the aortic hiatus. Now we talk about the smaller openings in diaphragm. The point to remember about the smaller openings is that we talked about the 3 large openings. At the level of T8 we have the vena caval hiatus. At the level of T10 we have the esophageal hiatus. At the level of T12 we had the aortic hiatus. These hiatus were present at the specific levels. You need to remember these levels. Now these smaller openings are of these things in the diaphragm. They make their separate opening in diaphragm. They do not pass through T8, T10, T12 or the larger hiatuses. They pass through their separate openings in diaphragm. So this has the hemiazygous vein because the azygous vein was passing through the aortic hiatus. And then we talk about the left phrenic nerve. Left phrenic nerve makes its own smaller opening in diaphragm, whereas the right phrenic nerve was passing through the vena cava hiatus. Okay, so these are the things making their separate opening in diaphragm and passing through diaphragm. Okay, now we talk about diaphragmatic hernia. So there are two triangular spaces without the muscular tissue in diaphragm, and these triangular spaces are the sternocostal triangle, and the second one is the lumbocostal triangle. These two triangles in diaphragm are without muscular tissue. These are without muscular tissue, and these two are sternocostal and lumbocostal triangle. These two are the common sites of diaphragmatic hernia. Okay, so now we talk about the blood supply of diaphragm. Diaphragm is supplied by 4 sets of blood vessels, and first we have the lower 5 intercostal arteries. Then we have the subcostal artery. Then we have the superior phrenic artery, and the inferior phrenic artery. The superior phrenic and inferior phrenic are branches of aorta directly. The superior phrenic is the branch of thoracic aorta, and inferior phrenic is the branch of abdominal aorta, and lower 5 intercostal and subcostal artery are also supplying the diaphragm. Now we talk about the nerve supply of diaphragm. The motor supply of diaphragm comes solely from the phrenic nerve. C3, C4, C5. Okay, so the sensory supply of diaphragm is, look at this diagram. This is the highlighting part is the peripheral part, and in the center we have the central tendon. Central tendon receive the sensory supply from the phrenic nerve. Central tendon receive its sensory supply from the phrenic nerve, whereas the peripheral part receive its sensory supply from the intercostal nerves. Okay, so here I told you diaphragm is supplied by superior phrenic, inferior phrenic. Superior phrenic, as it is superior and branch of abdominal aorta, so this superior phrenic is the branch of thoracic aorta, and inferior phrenic is the branch of abdominal aorta. Now we have looked at the nerve supply. Let us discuss the functions of diaphragm. When we talk about the functions of diaphragm, so diaphragm is an inspiratory muscle. We know that diaphragm is dome shape. Above it we have the thorax, below it we have the abdomen. Okay, so it's an inspiratory muscle. So how it plays its role in inspiration and expiration. During inspiration, diaphragm contracts. When it contracts, it moves down. When it moves down, the volume of thorax, because above it is thorax, when diaphragm moves down, okay, so the volume of thorax increase and inspiration occur. Okay, what happened in expiration? Diaphragm relax. When diaphragm relax, it moves up back to its normal position, and the volume of thorax decrease and expiration occur. Then the next function of diaphragm is abdominal strain. Diaphragm contracts together with abdominal muscles to increase the intra-abdominal pressure. Intra-abdominal pressure is increased to expel the things out of the body, like in defecation. Increased abdominal pressure is required in defecation, in micturition, in parturition, even in vomiting, coughing. Okay, so, and the next function of diaphragm is hiccups. Hiccups are also caused by diaphragm. These are the spasmodic, sharp contractions of diaphragm are hiccups. Okay, So there arises a question: what will happen if diaphragm contract to the large hiatus? Okay. So our question is, what happens to the large hiatus when diaphragm contract? We know diaphragm contract during inspiration, and the large hiatus are present at the level of T8, T10 and T12. The hiatus at T12, the aortic hiatus, remain unaffected during diaphragm contraction. As it was before contraction, it stays the same after contraction. Okay, the hiatus at T10, the esophageal hiatus, it get closed when diaphragm contract. Okay, the hiatus at T8, the Vena Caval hiatus, it dilate. When diaphragm contract, the Vena Caval hiatus dilate to increase the venous return. That's all about this video, and if you have any questions, you can comment down.